Hello there. Welcome to Chapter 11 Poison and Substance Abuse. This is part of your emergency medical responder course. We're going to be covering the different types of poisonings and the different kind of substances that we encounter as first responders when we run on our patients. All right, just as a quick introduction, poisons. It's a substance. It's a substance that can make you sick, plain and simple. It can cause illness or death when eaten, whether it's drank, whether it's inhaled, whether it's injected, or absorbed in relatively small quantities. You guys need to be able to recognize when there's a poison and act quickly to save someone's life. All right, so poisonings can be classified basically in the way the poison enters the body. The first two that we're going to talk about is ingestion and inhalation. Poisons by ingestion very simply enter through the mouth and is absorbed by the digestive system. Inhalation is when a poison enters through the mouth or nose and is absorbed by the mucous membranes. Injection, pretty simple. It's when the poison enters through a small opening in the skin. It spreads throughout the circulatory system, usually causing some kind of widespread type of reaction, especially if the patient is allergic to whatever it is they were injected with. And then absorption is very simply where it enters the intact skin. So it gets on the surface of the skin and absorbs through and causes the patient to become ill. All right, so once again, patient assessment for poisoning, it's the same as any other assessment. You have the five components of scene size up, primary assessment, history taking, secondary assessment, and reassessment. And your scene size up with poisonings, some particular attention that we're going to talk about, you need to protect yourself because remember, poisonings can also get on you, especially if it's something in the air or something in some powder form that the patient may have been exposed to and they're going to have to be decontaminated. And the primary assessment is managing any life threats, and history taking is getting the sample history from the patient. Secondary exam is your head to toe, and then your reassessment. All right, so general assessment and treatment for your patients with poisoning. Follow the assessment sequence. Those five components are your key to success. Obtain a thorough history from the patient and find out if they're allergic to something that they may have become exposed to, such as a bee sting or a medication that may be new. And also, if the patient is unable to give you that information, you want to talk to bystanders. Be alert for any of those visual clues that may indicate poisoning, like redness of the skin, urticaria, those kind of things, hives, bumps, sweating, nausea, vomiting, those kind of things. Much of your emergency care depends on those patient signs and symptoms. All right, some general signs and symptoms of poisoning. This is in your book, Table 11-1. The history, respiratory system, digestive, central nervous system, and other things are things that we look for. History of ingestion or inhaling or injecting some kind of or absorbing a poison. Any in respiratory problems like difficulty breathing or decreased respirations. And then for the digestive system, nausea, vomiting, abdominal pain, and diarrhea. And with a reaction, when we talk about central nervous system, are they unconscious? Do they have altered mental status? Do they have dilation or constriction of the pupils? And are there any convulsions? And then finally, other things that you may see in poisonings is excess salivation. Otherwise, they're slobbering. Their body's trying to get rid of it. Or sweating. Again, the body's trying to get rid of it. Cyanosis, that's a bad thing. That's when they have a very bluish tint of skin. They're not getting enough oxygen. And if you see any empty containers on the scene, especially in overdose situations, you want to be very, very careful with your scene safety and make sure that you find these things as you enter, as you have determined that the scene is safe. More than 80% of all cases of poisoning are caused by ingestion. So somebody has put something into their mouth, whether it was intentionally, unintentionally, but it's something that's gone into their mouth. Then we have chemical burns. Chemical burns may be characterized by odors or stains that are around the patient's mouth, so you need to be looking for those. Signs and symptoms to include nausea, vomiting, and also abdominal pain. Other signs and symptoms: diarrhea, abnormal or decreased respirations. They may be unconscious or have an altered mental status. And then, of course, they may be having seizures as well. Treatments. Number one is we have to identify the poison. We have to figure out what it is. Once we've identified what the poison is, you'll call medical control or call the Poison Control Center based on your local protocols to determine what your course of treatment is going to be. If you're unable to contact the poison control, primarily the things that we do is to dilute the poison by giving water as a first responder. Now, they may be vomiting, and if they are, that may not be practical, but if we can give water and then arrange prompt transport to the hospital. All right, so activated charcoal. It's a wonderful, wonderful piece of medication that some EMRs carry or have access to. Activated charcoal is exactly what it says. It's charcoal. And what charcoal does is it binds to whatever it is they've been poisoned by. This is used very commonly in patients who have ingested, they've taken by mouth some kind of medication or something they were not supposed to take. And it's indicated to use to bind to that particular medication or drug in order for it not to be absorbed into the system. Do not give if the patient has ingested any kind of acids or alkali, stuff that's under the counter. We don't give activated charcoal for that, or has ingested what we call a base. You have acids and you have bases. Or obviously, if the patient's unconscious, because the thing about activated charcoal is that the patient has to be conscious to take it by mouth. There's a picture of it. This is Actidose. Okay, it is a liquid solution. Usual dose is 25 to 50 grams for an adult patient, 12.5 to 25 grams for a pediatric patient. You put it into a cup, stir it up, make sure it's well activated. I always tell people before you put it in the cup, shake it up real good. Shake this up very, very good. And what it does is absorbs and binds to that poison so that it won't absorb into the system. It won't pass the stomach lining because it's bound to the charcoal. Then they can freely either vomit it up or they can pass it through normal defecation. So it's just going to pass through. It also has a laxative into it as well, so it'll help to facilitate that. So vomiting, do not give anything to induce vomiting. American Association of Poison Control Centers does not endorse using Epicac. If you're not familiar with that, Epicac is a syrup that's very irritating to the stomach. When you swallow it, you will throw it up. So if you ever see any of that out there, if it's still available in the pharmacies or if the patient has it in their cupboard, don't use it. Activated charcoal is much more effective in these kind of patients. All right, so inhaled poisons. Remember, we talked about this. This is when somebody inhales it. They have breathed it in either through their nose or through their mouth. Specifically, some toxic substance like carbon monoxide are very poisonous but not irritating. You can breathe carbon monoxide just, when you're at an intersection and your windows are rolled down when you're driving your car, you can smell it all the time. But other toxic gases like chlorine gas and ammonia are very irritating to the respiratory tract, and generally people try to evacuate the area before they get too much of an exposure. Signs and symptoms of inhaled poison: respiratory distress. They can't breathe. They're having a difficulty time breathing. They may be dizzy. They may have a cough. They may have, headache, complain of headache. They may be hoarse. They may have a very hoarse or raspy kind of voice. And then, of course, they may have confusion because they may be having a lack of oxygen. And they could also be experiencing chest pain. Carbon monoxide. All right. So, common causes of carbon monoxide poison, including an improperly vented heating appliances. So, if somebody's using some kind of petroleum powered kind of heater within their house and it's not ventilated, they're going to be breathing all that carbon monoxide. And that carbon monoxide binds to the red blood cells and it prevents our red blood cells from getting the oxygen that we need to survive. Also, smoke from burning buildings. We know that when we respond to a fire, that where there's fire, there's smoke, and that smoke contains high levels of carbon monoxide and other gases that are very, very bad for us. Signs and symptoms: carbon monoxide, they may have a headache. That's one of the first things that they start to complain of. Nausea, disorientation. unconsciousness, and flu-like kind of symptoms. One of the most common poisons from carbon monoxide or poisonings from carbon monoxide is when we go through hurricane season and they don't want their generator outside in the rain, or possibly where somebody could steal their generator, so they make the unfortunate decision to move it into the garage. Then they go to bed. That's bad, because in the garage, that carbon monoxide that's coming out of that engine is going to be going through the AC's ventilation system, and they're going to get poisoned from that. That's a common one that we see during storm season. Ammonia. Some of the irritants that we have, one of them is ammonia. You may even have ammonia, under your kitchen sink or in your bathroom. It's often found also in agricultural settings because they blend it with the soil to negate certain, types of minerals and things that are in the soil that they don't want. But it's very strong and has an irritating odor. It's highly, highly toxic. It causes violent coughing and skin burns. So anyone who enters an environment containing ammonia, if you're going in there for a particular reason, you have to make sure that you ventilate the area, and then also be sure that you have a self-contained breathing apparatus. That breathing apparatus is going to allow you to go into the area to be able to be safe. And those are generally done, it's called the SCBA. This is usually performed by the fire department, or, by your local EMS system. Okay, these are a couple of photographs of some examples of two things. The first one is the fertilizer that's being spread, or ammonia that's being spread by a tractor. That's on your left there. That's in your agricultural purposes. And then on your right is an SCBA that's commonly used by firefighters and other first responders to go into an area that is, polluted with either, ammonia, carbon monoxide, or anything that you would want to breathe in. All right, so continue on with irritants. Chlorine. Boy, that's an easy one. There's chlorine everywhere. If you live in an area that's saturated with pools, like we have here in Florida, there's lots of chlorine that's usually in containers, but it also comes in a gas form as well. And like I said, it's normally found around swimming pools and also water treatment plants. It's really bad in the lungs. It irritates the lungs very, very bad, and the upper respiratory tract. Causes violent coughing and skin burns, and anyone who enters a environment that has chlorine needs to be wearing that SCBA protection. So presence of hazardous materials that are toxic can usually be found through the placard system. This is in the back of a vehicle that we're able to determine that there is, some kind of gas that's there. That's a free kind of gas that would be available. You find this anywhere that has to do with, if they have, fuel, if it's flammable, anything like that. It's going to be there in the markers or the placards. We use a DOT system that is a book called the Orange Book that identifies these. So anything that you may see like this is going to be a warning to you to stay away from it. Identify whatever it is first before you involve it. This first one that I just circled here on the right, 1993, is a fuel base. You can also see over here in 1084, this is a corrosive base, some kind of acid. So that would be something that would clue you into this may be a problem. All right, so for treatments, pretty simple treatment for any of these kind of problems. We want to remove the patient from the source of the gas, whatever it is, get them out of there. Okay, that's the number one thing, and make sure that you have the protective mechanisms that you need in place, such as the SCBA. And if you don't, do not enter. Let somebody else enter, and that is trained to manage these kind of incidents. Usually, the fire department does this. Then, if the patient is not breathing, begin mouth to mask breathing. If the patient is breathing, we want to administer large quantities of oxygen and get them to the hospital as soon as possible. All right, so injected poison. There's two major causes of poisoning by injection. First one is going to be animal bites and stings, and then a toxic kind of injection. The signs and symptoms of this is obviously there's an injury to the site, especially if it's an animal bite or a human bite. And then it could also be a sting mark as well. There could be a welt there where a bee sting happened or a wasp sting, that kind of thing. Tenderness around the area, some redness to go along with it, swelling, also possibly some red streaks radiating from the injection site. Weakness, dizziness, and localized pain and also itching could be associated with any of this. So any of these could be signs and symptoms that there is an injected poison. So you're going to have to look for it. You're going to have to find it. So what do we do about it? Keep the patient calm and keep them still. Wash the site with soap and water should be the first thing that you're going to do. If there is a stinger, like a bee, okay, bees leave their stinger behind. If there is a stinger, remove the stinger using a gauze wiped over the area or your fingernails. So take a little piece of gauze and just wipe it across the area and it should pull the stinger out. Or use your fingernail or a credit card, the patient's driver's license, anything to scrape it out. The one thing that you do not want to do, you do not want to grab it with your fingertips and squeeze it. Many times, when the bee pulls away from their stinger that's barbed into the skin, it leaves the poison sac intact. So if you squeeze it at all, it's going to put more poison into the body. So don't want to do that. After you've got the stinger out, apply an ice pack. It'll help to reduce the swelling and also relieve some of the pain. Now, listen, sometimes people experience an allergic reaction to this and they go into what we call as anaphylaxis. This is a very bad situation. Most people that have, allergies to envenomation or to be stung by a bee or whatever the case may be carrying an EpiPen. And we're going to talk about that here in just a minute, what the EpiPen does for us. All right, so signs and symptoms are continued on with the treatment. Signs and symptoms specifically of anaphylactic shock, itching, hives, swelling. When it really gets severe, they get a lot of swelling in their throat. They'll have a hard time talking. They're going to be wheezing and they're going to start having severe respiratory problems, specifically respiratory distress. They'll also have generalized weakness and potentially even loss of consciousness. They will also have a rapid and weak pulse. Okay. Rapid and weak pulse. Then it goes into rapid shallow breathing and then eventually hypovolemic shock. Okay. The hypovolemic shock is your body that's reacting to the allergen, and you have what we call massive vasodilation. Vasodilation means when your arteries and your veins, they're nice and squeezed together normally. Vasodilation is when they get bigger. So if they get bigger, your blood pressure drops and you go into what we call hypovolemic shock. Treat for anaphylactic shock period. Treatment is number one, make sure to take care of their airway. Try to keep their airway open and clear. If you have oxygen, give oxygen and treat for shock in some of the cases. So continue on, remove the allergen as possible. Monitor the patient's vital signs. If the patient condition progresses to the point of respiratory or cardiac arrest, you're going to begin CPR. Now, the biggest thing is you have called 911 already. You should have called a long time ago. As soon as this person says, I'm allergic, and you guys are trying to find the EpiPen, call 911. That way they can get there and properly evaluate the patient and provide for immediate transport. All right, so EpiPens, there it is. That's what it looks like. It's a little plastic pen that it's an auto injector. So all you have to do is just remove the cap and remove the safety tip off the end of it. You know that it's the activation tip, and place it against the skin and inject it. So if that patient does have a prescribed auto injector, help them with it. If they need help, and most times they will either have already done this or they'll be in the process when you get there. But if you need to help them, place the tip of the auto injector against the outer thigh, push the auto injector firmly against the skin. The needle will come out and inject the epinephrine. That's what it is, epinephrine, and hold it for several seconds until the patient, says, okay, usually it's, 10 to 15 seconds until you're you believe that the auto injector, it isn't immediate, so you have to hold it for at least 15 seconds. All right, snakes. Ooh, yuck, snakes. There are four kind of venom in snakes in the United States, and they pretty much so come down to what we call a category of having a pointed snout or a pithed snout. They are very specific because they have fangs that retract up into their mouth. Those would be rattlesnakes, cottonmouth, copperheads, and coral snakes. Now, coral snakes are a little bit different. They primarily have to bite and chew their way to spread the poison within. They don't really have fangs, but they have teeth and they have glands that secrete a neurotoxin into the body. All snakes inject its poisons into the person's skin and muscles with their fangs, with the exception of the coral snake. Again, like I said, they don't have fangs, but they do have teeth so they can break the skin so that the poison will enter the body. All right, so our signs and symptoms. Okay, here they are. Immediate pain at the site, it hurts. Okay, obviously, when you get bit by a snake, it's going to hurt because the fangs have entered the skin. You should see some swelling and tenderness around the bite itself. Patient may faint because it's kind of traumatic, especially especially if it's a child or it's an elderly, those kind of things that may cause them to faint. You will see some profuse sweating because it's the body now trying to react to the poison that's entered the body. Also, nausea and vomiting is very, very common in people that have been bitten by a snake. And then finally, shock. You'll start seeing signs of shock. All right, so what was talking about earlier with the coral snake, again, it's different. They don't have fangs, but they do have teeth. And those teeth break the skin, and then the little glands within inside the mouth begin to secrete their neurotoxin. So it causes respiratory difficulties. It can actually cause the paralyzation of the diaphragm, which will now, without your diaphragm working, you will not be able to breathe anymore. And because it is neurotoxin, you may see slurred speech. They may have some paralysis. They have facial paralysis, paralysis in the area of where they were bit, which could further lead to coma or they're unconscious, or even potentiality of having seizures. Treatment, pretty simple. Keep them calm. Keep them still. You don't want the poison to be spreading through the body. You want to sit them down, lie them down, try to get them to relax as good as possible. Wash the bite area, soap and water. Hey, because remember, especially with a coral snake, the neurotoxin has to absorb into the skin. There's some bites, some teeth marks that where they have torn the skin, so some of it's starting to absorb, but you want to get all that off the surface. Treat the patient carefully, trying to keep them calm. Put a pillow under their head, let them relax, keep them calm, and then you need to make sure that we call 911 right away, because the only thing that is the ultimate treatment for a snake bite is anti-venom, which is only carried at the hospitals. All right, absorbed, like we were talking about earlier, something that gets on the skin. Okay, something that's on the skin. This occurs when the poisonous substance enters the body through the skin. Most commonly, insecticides, bug spray. Okay, especially when the yard gets sprayed and you go out there and you walk around with your bare feet, you're getting a poison directly into your skin. So we don't want to do that. And then also, there could be a toxic industrial type of chemical accident. Primarily, the signs and symptoms, they do vary or range. You may see traces of powder if it's a dry powder on the skin. You want to make sure to brush all that powder off as quickly as possible, and then make sure to flood it with a lot of water to rinse it off. Then you may also see inflammation or redness of the skin as well. Other signs and symptoms, chemical burns, you can see blistering, you can see what we call sloughing of the skin. It's kind of like the skin peels. It's beginning to separate from itself. You may also see redness or a skin rash. Burning, patient complains, oh my God, this burns, this burns, this burns. And it itches like crazy, nausea, vomiting, dizziness, and shock. So, what do we do to treat it? All right. So, biggest number one, Make sure they're no longer in contact with the poison. Okay. Usually your hazmat team takes care of this. These are the guys with the suits. They get them out of whatever location it is that they have been poisoned in. They begin to decontaminate them. But first, before they start the water decontamination, if it's a dry chemical, they're going to brush it off. Okay, don't wash, because if you wash a dry chemical, it's going to turn it into a liquid and then it's going to absorb more quickly. So get the dry powder off first. Contact with water, it very well may activate certain types of chemicals to do a big reaction. Like if you have magnesium, water hits magnesium and it burns. So we want to make sure that we identify what it is and we brush off what we have before we start the washing process. We always say in the field, the solution to pollution is dilution. So get the powder stuff off and then dilute it with water, 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 water. Wash the patient completely for at least 20 minutes. We do not want to induce hypothermia, though. We need to be careful not to do that. So if it's on their clothing, all the clothing has got to come off. I mean, every bit of it. No underwear, no bras, nothing. It has to come off because chemicals can get trapped underneath that. And with that said, it can cause the patient some significant problems. All right. So in addition, EMS personnel are delayed. If EMS personnel are delayed coming, so contact your poison control center on how you're going to continue with your treatment. To also include, get in touch with your medical director. If the patient is experiencing shock, have the patient lie down, elevate their legs. Okay, that's helpful. If the patient's having difficulty breathing and you have it, give them some oxygen. Nerve agents. This normally is not something that we come into contact with. It's only when there's usually a terrorist type of act that's happened. We don't have any nerve agents just hanging out from the grocery store or the pharmacy. It just doesn't exist. They are among the most deadly chemicals developed. Small quantities can kill large numbers of people by causing cardiac arrest within minutes of the exposure. So you need to make sure that we identify what this is, stay away from it. Usually you're in a safe area, patients get decontaminated. You're not involved with this. The hazmat teams manage this to begin with. Foremost common nerve agents, and this is so that you're aware of it. I hope that you never, ever, ever get involved in any of this. I've been in EMS for 40 plus years, and I've never had an incident where I've had to deal with any of this stuff, but it's nasty. You have four different types that are common: sarin, which is GB; somain, which is GD; tabin, which is GA; and then VX agent or V agent. All of these are very common in the terrorist world, and they have been used in different places of the country with devastating results, to include here in the United States as well. All right, so plain and simply, these agents block essential enzyme and nervous systems, and they cause what we call sludgem. Salivation, which is your drooling or sweating, your body's trying to get rid of it. Lacrimation, which is excessive tearing of the eyes. Urination, you got to pee a lot. Okay. Defecation, which is, going to the bathroom, go and poop. Okay. Drooling and diarrhea. Gastrointestinal upset and cramps. Emesis, which is vomiting. And then muscle twitching or meiosis, which is pinpoint pupils. Additional system or symptoms of organophosphate include shortness of breath, slow heart rates, muscle weakness, twitching or paralysis, slurred speech, seizures, and loss of consciousness. There's not a whole lot of this out there anymore, because we used to use organophosphates in yard sprays and those kind of things, and it was prominent in many of the bug sprays that you could buy at your local hardware store. But they've pretty much so gotten away. You don't see a whole lot of this out there anymore, but every now and then you may have a patient that has been exposed to it, especially if you live in an agricultural setting, like you're going to an emergency that's in an orange grove or some kind of large industrial growing type of operation. So that would be about the only time. All right, so if you're called to the scene of a nerve agent poisoning, okay, keep yourself, rescuers, and bystanders from being contaminated. Otherwise, stay the hell away from it. Call it in, stay in the staging area, and then once the all clear has been called, then you can go in. Because only well trained hazardous materials teams deal with this. They are in special protective clothing and they know exactly what they're doing. They wear special self contained breathing apparatuses that are inside of suits so that they can manage these particular type of emergencies with a high level of safety. Treatment, assess and support the patient's ABCs. We do have antidote kits. You, as an EMR, would not be involved in the administration of these kits. That's why it's very, very important for you to call EMS early if you suspect this for any reason. And we have a duodope kit, which has two different type of drugs in it. They're listed here. I won't get into that because it's very detailed, but they're medications that will help to reverse the effects of a nerve agent type of poisoning. So there is some instructions that are in your book 11-3. There is a kit, just so you know, so that you can help the paramedic or the EMT prepare this kit. You can review this in your book on table 11-3. Substance abuse. All right, according to the National Survey on Drug Use, 8.1% of the population, or 21.5 million people, have a substance abuse problem. And Lord knows we have all kinds of different substances out there, especially like fentanyl, carfentanil, heroin, those kind of things. Substance abuse results in increased incident of also injuries and illness. Even if the primary reason for the call is some kind of substance abuse, it could be related to some kind of traumatic or a medical problem that the substance abuse is contributing to. So remember that. Most commonly abused drugs in the United States today, they're involved in a significant number of traffic fatalities, murders, and suicides. Alcohol. Alcohol. Alcohol intoxication. Number one. Okay. It's similar to those medical illnesses or severe injury. Make sure that you're extra careful with your exam on this because these patients tend to get a little violent or could, cause you some harm. So we need to be careful with these guys. Alcohol is an addictive, depressant type of drug. Persons physically dependent on alcohol can also develop withdrawal symptoms when they're away from it. The most severe symptoms include what we call DTs or delirium tremens. Signs and symptoms of the DTs is shakiness or restlessness. It's also some alcoholic that's been an alcoholic for quite some time that is now suddenly trying to quit, or somebody that was on a binge, drinking a lot of it for a long period of time or a short period of time and then stopping. So these can manifest themselves as the person withdraws from not having the alcohol any longer. Signs and symptoms of these DTs continue confusion, hallucinations, gastrointestinal distress, even chest pain, and sometimes they can have a fever. It's a very serious condition and they need to go to the hospital. It can be fatal if they don't get seen by, a physician in a hospital. Drugs, they may be ingested, injected, inhaled, or absorbed into the body. Okay? Can any of those happen? Look for clues that indicate what type of drug and the way it was administered, whether it was administered through inhalation or whether it was administered through injection. Also, abuse of prescription drugs. I mean, that's become very, very prominent over the years, or transition from prescription drugs to something a little bit harder that's illicit, such as heroin or fentanyl. Amphetamines, they stimulate the nervous system, the CNS. This is one type of abused drug. They include what we call speed, ice, crystal cocaine, or coke. Signs of amphetamine use include restlessness, irritability. They talk a lot. Okay, they're very, very talkative. The only thing we can do for them is keep them from harming themselves and transport them to the nearest facility. Pain relievers, such as what we call opioids. Okay, they're a narcotic, and heroin. So one of the first ones that's on the list is widely prescribed and sometimes abused is hydrocodone or Vicodin. The next one would be oxycodone or OxyContin, morphine, and then codeine. Signs and symptoms of an opioid or a narcotic overdose: slow, difficult, shallow breathing, or no breathing. So if they're having any of these problems, you make sure that you're breathing for them. They may have small or pinpoint pupils, weak pulse, low blood pressure, bluish nails and lips because they're cyanotic. They're blue because they're not getting enough oxygen. They also may be drowsy or have some kind of disorientation. Delirium. Delirium means they don't know where they're at. They are very confused. They're out of it. They do not appear to be normal. And some of these patients actually go into a coma. What we do to treat this, we use naloxone or Narcan. It's a widely used drug that is rapidly absorbed into the body just by simply spraying it into the nose. It reverses the effects of any kind of the narcotics. We have it in both intranasal and also injection as well. So here's an example of an intranasal administration of Narcan. EMRs can give this medication only if they're trained to do it and have the approval of their medical director. Hallucinogens. These are the things that make you see goofy things like flying elephants and pink giraffes and all kinds of weird things. They include PCP, LSD, peyote, which comes from a plant, usually out west, mescaline, mushrooms, those kind of things. These are chemicals that cause people to see stuff. It's not there, okay? It's in your mind because the drugs are making you see it. Signs and symptoms of these kind of overdoses, especially PCP overdoses, can be convulsions, coma, heart and lung failure, and also stroke. Try to reduce the auditory and visual stimulation. You can't reverse this. I can't reverse this. It can only go away in time. But they need to go to the hospital to get this out of their system. Be sure that you approach these people with caution. 'Cause remember, they're seeing things. They don't know what's going on. And like I said earlier, get them to the hospital as soon as possible. Abused inhalants. So, what normally happens in these kind of situations? We have a certain sect of people that will take a paper bag and spray some kind of paint or some kind of aerosolized type of product and then stick their face to the bag and inhale it. That's an intentional inhalation. And this is very dangerous. It destroys brain cells, it damages tissues around the nose, the mucosa, the mouth, those kind of things. Many of these substances can be bought in simple stores, okay, including hardware stores. They may cause drowsiness, unresponsiveness, seizures, or even cardiac arrest. If you have a patient like this, get transport available right away. Keep them calm and keep them still. With these patients, they may have a problem breathing, so you're going to have to try to give them some oxygen. If you are working in an industry that the EMR is helping an EMT, such as in an ambulance situation or first response, give them oxygen as soon as possible. And then carefully monitor their blood pressure, their pulse, their respiration rate, all of their vital signs, and make sure that we're getting them to the hospital as soon as possible. Okay, so toxic injection from drugs. The patient reaction depends on the quality or quantity and the type of drug that was injected. Usually, your signs and symptoms are weakness, dizziness, fever, chills, those kind of things. And usually, these are people that are common abusers of injected drugs like heroin, cocaine, those kind of things. And they'll have track marks that you can identify. They may even admit to it right off the bat that they have a problem. Many drug users do because they're ultimately seeking some kind of help. Other toxic injections on things that you can do support. You need to support the patient, treat their symptoms, make sure to get them to a hospital right away, and keep an eye on their vital signs because depending on what they injected, it may affect their central nervous system. So they start getting more drowsy, their respirations get slower. If it's a narcotic, we want to give Narcan. So these are all very important things that we need to do is to identify what that medication or what that illicit drug was. Check the injection site for any redness, swelling, or increased skin temperatures. That's an indication that there's an infection there. And many of the IV drug users do have lesions, and with their track marks, they may have some kind of infection going on. So be sure to glove up, use your personal protection equipment, always with every single patient, and be care and make sure that take care and be sure that your scene remains to be safe. That has a lot to do with what we talked about in patient assessment with situational awareness. General treatments for overdoses, drug overdoses, provide basic life support. Keep the patient from hurting themselves, provide reassurance, provide emotional support, make sure to get them to the hospital as soon as possible because they need to go. You know, the biggest thing we need to do for our patients is make sure that they get the help they need, to include substance abuse training, to rehabilitation. They need help, and most of the times when we get involved in it, many of these patients are asking for help. Administer naloxone or Narcan if you've been trained to do so and you're authorized and you have it, and then avoid classifying these people as anything. Be non-judgmental and be patient with the patient. Intentional poisonings, or such as attempted suicide, emergency treatment is the same, and the patient's going to need both medical and emotional support. All right, folks, it was good to have you in this particular session. I hope you got something out of this particular lecture. If you have any questions, you know how to get in touch with us. We'll be more than happy to answer it. With that said, I want you guys to have a great day.